This is Jean McKnight, Vice Chair of the Planning Board, presenting the Planning Board's recommendation on Article 19 to amend the zoning bylaw to provide for a pediatric medical facility in the New England Business Center District. The Planning Board recommends adoption of Article 19. Your warrant provides details, but briefly, this article amends our zoning bylaw to add pediatric medical facilities owned, operated, or managed directly by a pediatric hospital to the list of uses permitted by special permit in the New England Business District. The facility must provide only ambulatory services, not inpatient hospitalization, and primarily for children and young adults. The amendment also establishes that a pediatric medical facility must have at least one parking space per 290 square feet of floor area. If this amendment is adopted, we expect that Children's Hospital will apply to the Planning Board for a special permit to construct a medical facility at 380 First Avenue. This site is part of the area known as Founders Park, Center 128 West, where TripAdvisor is at the corner of First Avenue and B Street, and the Marriott Residence Inn is on B Street. Center 128 West also has the benefit of a special permit the Planning Board issued in 2012 and amended in 2013, 2015, and 2016 for the development of 4 office buildings with associated parking facilities at Center 128 West, including the TripAdvisor building and the Marriott Inn. 3 of the office building sites and a parking garage site remain undeveloped. And it is this portion of Center 128 West that Children's Hospital will acquire, intending to build its medical facility at 380 First Avenue in 2022. Children's will defer development of the parcels at 27A Street and 2B Street. Children's Hospital engaged the engineering firm Vanass Hangen Rustlin, known as VHB, to provide a trip generation study and a parking demand study. The Planning Board engaged its own engineer, Beta Group Inc., known as Beta, to review and comment on the VHB studies. All comments and requests for clarification by Beta were addressed to the Planning Board's satisfaction. The VHB trip generation report compared the trips estimated to be generated by all 3 buildings, the pediatric medical facility, a second building that would combine pediatric ambulatory use with office use, and a third building for office use. Comparing those with the trip generation estimates for the 3 office buildings previously approved for the site. VHB referred to the previously approved trip generation for peak hours as described in the environmental impact report submitted under the Massachusetts Environmental Policy Act in August 2015, and supplemented these estimates with actual counts done in October 2019. VHB found that the actual morning trips were about 37% lower than had been estimated, and evening trips were about 36% lower than estimated. And this was back in October 2019. The constructed and occupied buildings at Founders Park are not producing trips at their permitted rate, and actual trips to and from the site are below the permitted estimates. comparing the permitted trips that were estimated with the sum of the estimated trips to or from the proposed project, plus the actual counted trips, showed 127 fewer trips in the morning and only 51 more trips in the evening. The VHB comparative parking demand analysis compared our bylaw parking requirement for medical office and other office with national benchmarks for uses similar to what is proposed, and especially compared with the parking supplied per the 1,000 square feet for children's hospitals, 3 other suburban satellite campuses, Brookline, Waltham, and Peabody, showing an average parking rate of 2.87 spaces per 1,000 square feet for those 3 facilities. Using these metrics, the Needham facility would have an estimated parking need of 1,300 spaces. VHB proposed a conservative higher parking standard of 3.39 spaces per 1,000 square feet, which translates to 1 space per 290 square feet of gross floor area, or a total of 1,593 parking spaces, which will all be provided on site. The Planning Board agrees that the parking standard, which is set forth in Article 19, is reasonable and conservative. The pediatric medical facility will require a special permit. During that process, an updated traffic impact report will be required, and traffic mitigation conditions may be imposed by the Planning Board. Based on these impact reports and the discretion given to the Planning Board as part of the special permit process, and on the anticipated positive economic impact of this facility, ensured by the payment in lieu of taxes agreement and host community agreement negotiated by the Select Board, and the benefit to the children and youth of Needham that we expect this nearby health facility will provide, the Planning Board recommends adoption of Article 19. If you have questions or comments for the proponents or for the Planning Board, please email them to townmeeting@needhamma.gov prior to town meeting, so the questions and responses will be posted on the town meeting website. Thank you.